Welcome to the Centers for Disease Control and Prevention's National Healthcare Safety Network Data Quality Training for the Long-Term Care Facility COVID-19 module. In our discussion today, I will describe commonly observed reporting errors in the NHSN COVID-19 module and how they affect data analysis. We will use examples to review the protocols for reporting count data, including confirmed and suspected COVID-19 case counts, number of deaths, and census. Finally, we will discuss how to correct the data in the module. The long-term care COVID-19 module has 4 separate reporting pathways that enable an assessment of the COVID-19 in long-term care facilities. The pathways are resident impact and facility capacity, staff and personnel impact, supplies and personal protective equipment, ventilator capacity, and supplies. For each pathway, data elements consist of a combination of counts and/or yes or no type questions. For today's discussion, we will be focusing on the 3 pathways that require users to enter counts. In the resident impact and facility pathway, we will discuss data entry for COVID-19 suspected and confirmed case counts for residents, total deaths, total COVID-19 deaths, resident beds versus census. In the staff and personnel impact pathway, we will discuss COVID-19 suspected and confirmed case counts among staff and facility personnel, as well as total COVID-19 deaths. The supplies and personal protective equipment pathway does not have counts, so we will not be discussing that pathway today. Lastly, the ventilator capacity and supplies pathway, we will discuss total number of available mechanical ventilators, as well as the total number of mechanical ventilators in use by suspected or confirmed COVID-19 residents. I would like to first go through common reporting errors that we have observed in NHSN and their impact on analysis and reporting. So the first error that we commonly observe is rolling over counts from the previous day. In this example, I'm using fictional data to illustrate this problem. In some reports, the counts reported for admissions, confirmed, suspected, and deaths appear to be duplicate or aggregate counts. So starting in the last 3 columns that I have highlighted, we have the same number reported every day for suspected, confirmed, total deaths, and COVID-19 deaths. Or another common error we observe is that the number of data entry seems to increase incrementally, as this example in the first 2 columns. And this would happen if the first count is increased by 1 or 2 each time the data is being reported. All of these errors lead to overcounting cases or deaths from your facility. It is important to report only the new count since the last reported in order to avoid an overcount of cases or deaths for your facility. The next commonly observed error is excluding COVID-19 deaths from the total death count. In this example, the total number of COVID-19 deaths reported is excluded from the total death count. So as you can see, on May 8th, the facility reported 1 total death and 4 COVID-19 related deaths. This is incorrect because when you are reporting total deaths, you are reporting deaths from all causes, including COVID-19. To correctly enter this data, we should include 5 for total deaths and 4 for the COVID-19 deaths. In another example, on May 11th, the facility had one COVID-19 related death. So the total death column is reported as 0. This is also incorrect because, again, it excludes the number of COVID-19 deaths that should be included in the total death reported for the facility. To correct this error, the facility needs to enter 1 under the total death column and 1 under the COVID-19 death column. The number of deaths related to COVID-19 should never exceed the total deaths reported. In this next example, we can see that there are missing data in multiple fields. When you are reporting, if the answer is 0, if you have no counts to report, the correct answer should be 0. Leaving answers fields blank in the NHSN application will be reported as missing data. And missing data is excluded both from analysis and could lead to errors in the reporting sent to CMS. Not completing a pathway, as shown in this example, or not reporting data in the pathway is also considered missing data and impacts the report that is sent to CMS. Finally, in this example, the facility has answered yes to the question, do you have ventilator-dependent units and/or beds in your facility? However, the first question afterwards, which requires the number of mechanical ventilators, the facility has entered a 0. This is incorrect, because the facility, when you enter yes for the first question, it is required that you enter a number greater than 0 for the number of mechanical ventilators in your facility. Errors in data entry can lead to incorrect data being reported publicly for a facility. It can also prevent accurate assessment of a facility's needs and impact analysis that assess reopening. Now I'd like to discuss how to enter the count data in order to avoid the errors that I have described. For our discussion today, I will be using fictional data for 2 consecutive weeks, from Friday to Thursday, as shown on this worksheet. Week 1 shows data from May 22nd to May 28th. Facility users with limited resources or working with manual line lists may want to consider adding the COVID-19 elements as shown on this worksheet to their line list. Users can also create a worksheet similar to this one with the counts that are needed for entering data into NHSN. These counts are based on a full calendar day. For example, for Saturday, May 23rd, there were 3 new confirmed, 0 suspected, 5 total deaths, of which 1 was COVID-19 related. The counts for May 23rd are new for that day and are not rolled over from the previous day. Week 2 shows data from May 22nd to June 4th. The worksheet shows the new cases and deaths for each day. For Thursday, June 4th, there were 2 admissions, 1 confirmed case, and 0 suspected case. There were 3 deaths among residents. Out of those 3, 1 was COVID related. It is possible to have more than 1 line list since you will be reporting similar count data for the staff and facility personnel pathway. So using these 2 spreadsheets, I would like to give an example of how you would be entering data on a weekly basis. First, let's review some best practices for those facilities reporting weekly. When collecting data for the COVID-19 module, collect and record data at least once a week. Report on the same day every week if possible. It is also helpful to use a worksheet as I discussed earlier, or you could use the NHSN forums available on the COVID-19 module website to assist in data collection. So here's our worksheet again for week 1. If you are entering data weekly in NHSN, you would add the count for that week, as I've highlighted at the bottom of the worksheet. Please remember, if you decide to enter data weekly, do not enter any data on any additional days during that week, or you will have inflated data. One quick point I would like to discuss. A resident may be counted as suspected on one day and then later on another day have a positive COVID-19 test result. In this case, the resident would be counted as suspected on the day they present with signs and symptoms and confirmed when they have a positive COVID-19 lab result. A facility should not remove the count when the resident's status changes. This slide shows the line list for week 2, and as in the previous slide, the last row shows the total numbers for the week that will be entered in NHSN. To report COVID-19 data in the NHSN application, enrolled facilities must log into the NHSN long-term care facility component. Once logged in, you will be taken to your NHSN homepage where you will see the COVID-19 module option on the left navigation menu. For long-term care facilities that are only enrolling to report COVID-19 data, you may notice a different look to your NHSN homepage, as you will not see the options for other types of NHSN reporting, such as HAI or resident level data. However, the functionality for the COVID-19 module is the same for all long-term care facilities. Once you click on the COVID-19 module button, you will be taken to the calendar view. The default view is for the current month, but we can use the arrows at the top that I've highlighted to move the calendar back to the date of interest. The date range appears at the top of the calendar as I have highlighted. In our example, the facility will be entering data every Friday, so we navigate to Friday, May 29th. At the top of the data entry page, you will see the date for which the data is being entered, and that is Friday, May 29th. Another feature is the date create. This field saves the date and time that the report is completed. This facility is entering data on May 29th for the previous 7 days, which are May 22nd to May 28th. During this time period, the facility had 10 admissions, 12 confirmed, 18 suspected, so we'll enter that in our field. The facility had 9 total deaths. 3 of those deaths were due to COVID-19. The next week, we are entering data for the facility on Friday, June the 5th for the week of May 29th through June 4th. The data for the previous week should not be included in the current week. So we entered the data for the new admissions confirmed and suspected for the week. For the second week, there were 10 total deaths, of which 6 deaths were caused by COVID-19. Now let's see how we enter data for the facility capacity portion of the form. The first time that data was entered for this facility, 125 beds were entered as the total number of beds. This is the number of all beds you're licensed at your facility. This number will remain the same in the subsequent weeks of data entry. For the current census, We will enter the number of residents that are occupying the bed in the facility at the time of reporting. So even if you're reporting data for the week, you would only enter the number of resident occupied beds for that day. In this example, there were 80 beds occupied in the facility on the day this data is being entered. New testing questions have been added to the facility capacity portion. I'll not go in depth into these sections, but I did want to highlight them during this presentation. And here I have an example of the resident portion of the test questions, and there's also a staff and personnel portion. The next pathway I will review is the staff and personnel impact pathway. This pathway focuses on the impact of COVID-19 on staff and facility personnel, including staffing shortages. For today's discussion, we will focus on the count data, which includes the number of confirmed, suspected, and the number of COVID-19 deaths among staff and personnel. NHSN defines staff and facility personnel as anyone working or volunteering in the facility, which includes, but is not limited to, contractors, full-time, part-time employees, as-needed staff, temporary staff, resident caregivers, or shared staff. Like other count data discussed, these questions require new counts only, since the last time the count was entered into the module. As a reminder, a response must be entered even if the response is 0, because a blank field indicates missing data. The fourth and final pathway is a ventilator capacity and supplies pathway. For this discussion, we will focus on the ventilator counts, which are entered only for facilities that have ventilator units and/or beds. If your facility does not have a ventilator-dependent unit or beds, answer no and then click Save at the bottom of the form to exit. In this example, the facility has answered yes to the question. For the ventilator counts, the questions need to be entered each time that facility submits a report. For the first question, enter the number of mechanical ventilator beds in your unit in your facility. For example, we have entered 5. For the next question regarding the number of ventilators used by residents with confirmed or suspected COVID-19, this would be the count on the day the survey is being completed. This is not a cumulative count. In this case, we have entered 0 for the response, because on that day we do not have any confirmed or suspected resident using ventilators. Once you click the Save button, the date field will register the date and time that the report was created. In this case, the report was created on May 29th at 8:12. So the first date on the form lets us know the date for which the data was reported, May 29th. The second date on the form the second date is the date the report was created. So now I want to switch gears a bit and discuss data entry for facilities reporting daily or more than once a week. Remember, as for weekly reporting, it is important to be consistent in data collection and reporting when entering data daily or more than once a week. So we'll review again, starting with the resident impact pathway. Here I show an example of daily data entry into the NHSN COVID module, starting with the first date on the line list, May 29th. On May 29th, we had 1 admission, 0 confirmed and suspected. If you do not have any counts to report, as in this example, please add 0 to the field. Do not leave the field blank because they will be reported as missing data. For the number of deaths, we see here that the facility had 1 death, and it was due to COVID-19. In this case, we will add 1 for the total death field and 1 for the COVID-19 death column. If you enter counts on the same day as collected, be sure that any counts that occur after reporting is entered by going back to the calendar day and updating the counts. Continuing with our example of daily reporting, here we have the counts for the next day in our line list. Since we are only entering new counts each day, the counts for the day before are not included for the entry on May 30th. So for May 30th, we had no new admissions, 3 new confirmed COVID-19 cases, 4 suspected cases. We also had 2 deaths from all causes, including COVID-19, and 1 of those was COVID-19 related. For the current census, we will enter the number of residents that are occupying the bed in the facility at the time of reporting. For this example, we are returning to May 30th and reporting date, and on that date, there were 50 resident beds occupied in the facility. As previously discussed, the count data for the staff pathway require new counts only since the last time the data was entered in the module, and this also applies for daily reporting. As a reminder, a response must be entered even if the answer is 0. The fourth and final pathway is the ventilator capacity and supplies pathway. For this discussion, we'll again focus on facility that has indicated that they have a ventilator, beds, or unit in their facility. So for the ventilator count, so again, once the ventilator counts in this question will need to be answered each time the facility submits a report. For the first question, enter the number of mechanical ventilator beds in or units in the facility. So we've entered 5. And as before, the next question, the number of ventilator in use is applicable on the day the survey is being completed and is not a cumulative count. So in this case, we're entering 0 because on that day, there were no residents on ventilators. In addition to the date stamp that I've mentioned before, each completed pathway will appear green on the calendar date when once the data is entered completely. So once you have entered your data, I will be discussing how you can review the data to ensure accuracy. So in our NHSN COVID-19 module, we have newly added a dashboard, which provides a summary of data entered to the module and includes an interactive chart display where a user may customize data view. There are 2 main tabs for the COVID-19 dashboard, the summary tab and the confirmed COVID-19 and COVID-19 death among residents. Currently, the dashboard is only active for the resident impact and facility capacity pathway. First, let's discuss the summary tab. The summary tab displays the count data for the resident impact and facility capacity pathway. So for the dates of May 22nd to May 29th, the tab will summarize the number of admissions, the number of suspected and confirmed, as well as the number of COVID-19 related deaths among residents. You can use the calendar to change the date range to display the data. The next tab on the dashboard is the confirmed COVID-19 and COVID-19 death among residents. It displays a graphical representation of data entered for the previous 14 days, ending with the data selected in the calendar. In this example, we have selected the date June 5th. The bar graph displays data for the week 14 days prior to June 5th. So from May 23rd to May 29th, and the week ending on June 5th, so from May 30th to June 5th. Users can also see daily reporting for a selected week by clicking on the bar graph. So in this example, we are going to click on the bar graph for confirmed cases for the week of May 23rd to May 29th. So I have my arrow highlighting that particular purple bar graph. Once we click on that bar graph, the view will display the confirmed data by week. So here we'll see what we saw before. And also it will also display the data entered daily for the week of May 23rd to May 29th. The dashboard is available for facilities and group users. More information on the long-term care facility dashboard can be found on the NHSN long-term care COVID-19 website by using the links provided. Another way facilities can view their data is by exporting the data. To export your data, click on the Export CSV button at the end of the calendar page. Here we have the choice of either selecting all the pathways, or we can also select one of the pathways listed to export the data reported for that pathway. The exported file is a line list of all data reported by collection date. Now I would like to discuss how facilities can correct the data if errors are found. You can correct the data entered by clicking on the calendar date to make the necessary corrections. Then you can click Save at the end of the page. So many reasons for correcting data could be data entry errors such as the repetitive count, missing data as previously described, or it could also be a change in the data such as you receive a test result that is positive after data entry. So we advise that if that were to happen, you would return to the date where you entered the data and update the counts that were previously entered. So I would like to finally leave you with a few takeaway and reminders about data entry into the COVID-19 NHSN module. Facilities must report either once a week or more than once a week, but not both. If reporting once a week, facilities should report on the same day every week if possible, and include only new counts since the last counts were reported. You can use the worksheet or NHSN collection form to document daily counts. It is also important to remember to add only new counts since the last time data was reported. Also, enter 0 if the answer is 0 for question requiring counts. Remember that blank data elements equals missing data. Total death counts must include deaths from all causes, including COVID-19 related deaths. Do not remove previously entered data if resident status changes. In the next two slides, I've added definitions for the terms that we've discussed today. These case definitions are also in the table of instructions for each pathway. We have received some questions regarding CMS reporting. NHSN sends CMS the data that is entered into the module, which means that if data are showing as incorrect on the CMS website, it is likely that the data that are being submitted to NHSN, either by the facility or by an entity submitting on the behalf of the facility, are incorrect. There may also be duplicate submissions from the entities entering on behalf of the facility. We advise that users verify the time frame that the CMS data report for the CMS data that is reported in order to find that data in NHSN. Log into NHSN to view the data from the dates listed on the CMS website. For more information, I have listed 2 links on the slide. Finally, here are some additional resources on the COVID-19 website where you can find information on the protocols, the table of instructions, and other information regarding reporting into NHSN. Thank you.